Good morning. Happy to be with you for another session of study skills. Today's topic is teamwork. I'll try to finish this maybe in half an hour or so, and then 10 to 15 minutes we will have discuss about your assignment. Okay? Any questions you have, any queries, any doubts, whatever it is, feel free to ask in the group. Now, why I say? Because the same doubt someone else might have. So please, excuse me, ask in the group. So when I explain, it is beneficial to everyone. So let us start with today's topic. Yes. Are you going to come inside? Come inside? You want to come inside? Don't make noise. Yeah. Okay, these are the objectives for today. Those who arrived late, can you be seated, please? Okay. First of all, let us understand why we learn about team. Why it's a topic for you in the first year of your nursing school. Is it the first time you are going to work in a team? Have you never been part of any team? Anybody who has already worked in a team?
Yeah, we went for voluntary for breast.
Yes, absolutely. I am sure all of you have already been part of a team, knowingly or unknowingly. We are part of the team called family. At home, we do have some common goals. In school, we are part of the family for whatever task was given to you, many projects, cultural activity, dance program, debate, quiz, anything you name it, we were part of a team. So what is the definition of a team? I request if you want to go through the presentation, you can keep it with you, but try to focus on the discussion. If you want to see the PDF or the PowerPoint which we have uploaded, you can do it at your convenience, but during the class, try to focus on the discussion. Why? It will help you to answer your questions better in your exam. It will help you to understand the topic better. Okay? You can say this video recording is again available. I can go back and see whenever I want. But the quality is different. The quality of audio may be different, and you will be again wasting more time. So it's better you are attentive here, be part of the present and try to focus. Okay, look at the picture. What comes to your mind? First of all, let us describe the picture. What do you see in this picture? Yes?
Group of people.
Yes, group of people. She said one point. Anything else? Do they look, how is their expression? Do they look angry or how is the face? At least some of them.
They are studying.
They are studying, good. How is their expression, like?
Calm impressions.
Calm, or they are, at least you can say they are not angry with each other, at least you can say they are not fighting with each other. As he mentioned, there are some textbooks in front of them, maybe a coffee, some cups, so that shows they are willingly sitting together. They are happy with each other. They are working towards a common goal. This is the definition of a team. A group of members working together with their own tasks and responsibilities to achieve a common goal is a team. Small group of individuals who share goals, commitment and skills to complete complex tasks. Usually the tasks achieved by the team are not simple. Usually it needs more people to work on it. They perform beyond the capacity of individuals, and all teams or groups doesn't mean all groups are teams. You travel in a bus or you travel in an aeroplane along with 10 other people. Do we call as team? Not necessarily. But a team is always a group. Okay. It's a combined effort towards a common goal. Why are we talking about this now? So, when you have been already part of a team in your school, why is it important again as a healthcare professional? Anyone else? Is being a team member in a school different from being a team member now? In certain ways, yes. In school, you make mistakes, you don't complete your task, or you don't agree with someone else, it's okay. But now, being a member of a healthcare team, we have to be more committed. We cannot say, I cannot do this task. We cannot be late. We cannot say we didn't understand. The information was not clear. Why? The outcome here is patient well-being. Knowingly, unknowingly, we may, be part of a team which resulted in death of a patient. Does it mean we will never come across death? Does it mean as healthcare professional we will always be able to save the patient? No, there will be times there will be a negative outcome, but as a team we fight till the end to save the patient. So being a team member in healthcare is all the more important. My next question is, why not a doctor treat a patient directly? Why do we need a team? Why not a nurse give CPR alone? Why do you need a team? Why? It's okay, tell me.
Because a nurse doesn't know everything.
Okay,
Each specialist knows what their job is.
okay,
So it depends on the situation or the emergency.
okay. So we need different people with a different strength. So does it mean doctor knows everything? No. Even the doctor, even the physician, they need some skill, some help from others. So only doctor and nurse enough to save a patient? Have you seen any other members of a healthcare team? Who else is part of the team? Triage nurse, porter, to move the patient inside and outside. Lab nurse, very important. The person to take the blood sample, lab technician, to someone to take X-ray, radiographer, someone, security. Even he is part of the team. Okay, many a times there may be some violence inside the hospital. Some psychiatric patient is there. He's trying to hit someone. Many hospitals also have very good security systems. So everybody is part of the team. The core team consists of mainly the doctor, nurse, and other people to maintain, and other people to maintain the ECG, echocardiogram. So in healthcare, effective teamwork is crucial for delivering high quality patient care, and also in education, especially in our college, you will be working in teams. If not now, maybe in another course or next year, you all will be working as a team. What do you see in the first picture? Okay. Okay, it's we also see a nurse, a doctor, another physician, or someone like a trauma care technician. Not everyone in a healthcare team is a doctor. Not everyone in a healthcare team is a nurse. We do have other positions who are specialized. They are called allied health professionals. Someone specialized in dialysis alone. Someone will specialize in echocardiography. So they are also part of the team. So what do you see in the, does this picture satisfy the definition of a team?
Yes.
They are a group of people? Yes. Number 2, are they working together? Yes. Number 3, different roles. Okay, yeah, different specialty, and they are, each one of them are focusing in different tasks. When you say a team, they try to achieve a common goal, but they do different roles. For example, in this, she is trying to maintain the, give some injection, she is trying to maintain the airway, and this person is trying to auscultate the chest, and she is recording the blood pressure. So all of them, they know their roles and there is no confusion. Okay, each one of them have their own task. What about this picture? Is this different from this? Yes, similar situation, but here the team is bigger. What is this picture? This one? It's a surgery theater. Yeah, scrub nurse, you have a surgeon, you have different types of nurse. We have someone to maintain the electric recording of a patient. So it's a bigger team. In surgery and emergency room, we usually have a bigger team. Why? Can I request you to keep your phone? Yeah. Thank you. Why do we have a bigger team in a surgery theater? Because anything can go wrong. And can we afford to waste time? No. Within second, they will declare. You know how they declare the emergency? They give different colors. Code red, code blue, code brown. So the team is trained in every code, and when they hear the word, they know what to do. This is in a healthcare setting. We might think a team means everybody should be inside a room. Okay? No. In today's modern world, you can be part of a team even if you're 1,000 miles apart. We communicate. What happened in COVID? Some experts were in different places. We helped these patients in Africa. We helped patients in India. We shared expertise. They didn't know how to manage. Then we said, give this medicine, that medicine, through video conferencing, through telemedicine. So when we say teamwork, doesn't mean we are physically present. Even in a virtual world, we can be connected. Even that is called teamwork. This is an example of such a bigger team who are connected through technology. Okay, share information, get recommendation, get expertise. Okay. So in healthcare, these are the examples. What are the examples of teamwork in education? Assignments, that could be group seminar, quiz, debate, presentation. Yes, and sometimes it could be a project or problem-based learning, sometimes research. We encourage students to do research as a group. Okay. How small a group can be as a team, or how big it can be? Can we call 25 students in a group as a team? Yes, to some extent, but do you think that team with 25 students will be very efficient? Can we ensure all 25 students in the group is contributing to project or assignment or presentation? No. definitely there will be some people in that group who are not accountable, and it's not easy for you to manage so many people. So that's why the research says the effective size of a team, this is the magic number, 8 to 12. Again, is it possible to have 8 members in a team? No. Sometimes it is 3, 4, sometimes it is 15 or 20. But the question here is ideal number, 8 to 12. And it is a learner-centered setting. When we say you are a team, for everything teacher will not come and check. Did you do this? Did you do that? Blah, blah, blah. No. We trust you. We give you a task and we think you are discussing about the task and come out with the plan. So it is more of your responsibility. That's why it is called learner-centered setting. It is not teacher-centered or tutor-centered. Why learning in small group is so important? It helps us to work collaboratively. We agree to disagree. Okay, we fight, but at the end of the fight, we come to some conclusion. So we try to share the strength, yes, and also help each other. Maybe someone is very good in putting IV line. You know, as a healthcare professional, you'll be inserting catheter, you'll be inserting a needle. Maybe some of you are very skillful in that. Some of you are very good in maintaining patient records. So you discuss, okay, you take care of the patient in this way, I will do that job. So we share expertise and help each other. Okay, it also helps us to solve the problem, teamwork, and in a team, usually we don't sleep. Okay, when you're working as a team, we try to be active. We try to contribute. So people become active. And many a times students come and ask me how the exam will be, how the assessment is going to be. What should be my answer? Should I say it will be very easy or difficult, or it depends on your preparation? What is the correct answer? When someone asks me how the exam is going to be, how midterm assessment is going to be, it definitely depends on the preparation. When I say preparation, does it mean how much you study on your own, or does it also include how much you focus during the lecture? Yes, both. When you focus here, when we stress on few things, when we say this is important, or this is how a group works, or these are the plus and the minus, it helps you to understand better. Okay, so try to attend the resource session even though it is optional. If you are inside the lecture hall, try to be attentive. Okay. Let us assume I put all of you as different teams. For example, those 5 boys with another 5 boys as a team. I put them in a separate room and tell them within 4 hours, before 3 p.m., you have to write a paragraph on something, maybe about corona among Bahraini's. Okay. What will they do?
They're gonna split the class.
Directly, okay, let us assume 5 students from group A and 5 students from group B. They have not met each other. They are in a different room. But I put them together and tell them, in 3 hours you have to give me a paragraph on corona affecting Bahraini women or men. So what will they do first? Introduce themselves. Introduce each other. Okay, say I am so and so, I am from this country, that country, this is my strength, I am a volleyball player, blah blah blah. They discuss each other. Maybe they spend 2 hours in this stage only, maybe spend 1 hour for the remaining tasks. But still, the first stage is getting introduced. Any team, first stage is forming stage. It is a mixture of emotions. You will be excited, at the same time you will have anxiety. Okay, you are happy to work with the new team, but you don't know how the team members are going to be, so you are also anxious. So it's a mixed feeling. You start introducing each other and you decide goal, role. Maybe some teams select a team member. Okay, the tutor is more helpful here. They will not expect you to start working now itself. They will just help you to, get introduced if he or she is there. Otherwise, the first stage in a group is forming. You are just starting to form. Okay, these 5 students, and I said another 5 students. Do you think they will immediately agree? Okay, class, this website, this textbook, these are the words, these are the pictures, these are the references, come, let's start doing it. No, I am sure he will have an idea. He will say, no, this idea is the dumbest idea, my idea is the best. And he will say, no, my father worked in MOH, he knows better, so you should take my idea. So there will be some conflict. Is it good to have conflict? Yes, to some extent, yes. Conflict is good in a way, as long as it doesn't affect the outcome. We agree to disagree. No, yes, we have difference of opinion. No husband and wife, they agree on everything. No brother and sister, no friends. There will always be difference of opinion. Starting from buying an ice cream to buying a car, every time there will be some conflict. Which restaurant to go, which movie to watch, which channel to watch. Yes, every time there will be conflict. But do we stop? No. We discuss and then come to some understanding. So the second stage is called storming. We start discussing what is the feeling here, frustration or anger. Second stage, we are not happy. Oh, nobody is listening to me. We are not going anywhere. We are clueless. We don't know what to do. There is conflict. So this stage is called second stage. So what are the key words here? Frustration, anger, conflict, and disagreement. Okay. If you see in your exam, we describe a scenario and ask you which stage this healthcare team, you have to look for these words. If these words are there, you choose storming. If the question says they are introducing each other, they are deciding on their roles, then you choose forming. After storming, do we keep on fight? No. We decide, okay, madam has given us an assignment. It's already 1 p.m. We have only 2 hours left. Before 3 p.m. we have to submit, and then we assign roles and responsibilities. We accept the team. Okay, this is the team I have to work with them, and this is what I need to do. And they start to do their work, and they start focusing with their rules and tasks. Once you start doing your work, the fourth stage is you start to perform. Yes, you open a Word document, you start putting the content, and we are towards reaching the goal. This is the fourth stage. You start to perform. You are happy to be part of the team, and you get satisfied, you accomplish. These are the keywords: accomplishment, satisfaction. You appreciate each other, you assist one another, and the tutor here, they just observe. They will not only when you fight. In storming stage, the tutor will interfere. Hey, come on, what is this? Don't fight. In all other stages, tutor only observe or just give you some directions. So these are the 4 stages of team functioning. Okay. When I say 4 stages, sometimes it's not in this order. Sometimes the third step can happen before second step, or out of 11, 5 of them in forming stage, 5 of them in storming stage. But usually this is how a team progresses. This is according to old research. Now the latest research says the team has 5 stages. The 5th stage is detachment, because we will not work in the same team forever. Okay? You may be posted in different hospitals, you may be posted in different departments, so you will be working with different teams. So don't get attached, emotionally attached to a particular team. That is what they say, 5th stage. You finished your task, detach. Again go through 4 processes with the next team. But for our understanding, let us stop with these 4 stages. Okay, this enables collaborative learning, helps us to understand better, increase retention of information. All these things are advantages of teamwork. Now, can every team be very successful? No. Even at home, we do have some challenging people, especially you have siblings, some of them will be very supportive, some of them will always be fighting for the same ice cream you are eating, same chocolate they want, same bed they want to sleep. So it's not always so easy with the team. What are the different types of behavior we expect? Some of them are dominant, arrogant, argumentative, joking, bored, constantly late, lazy, shy. So what if someone is lazy? It's okay. They are not disturbing anybody. They are only lazy. So what? What will happen if one of the team member is very lazy? You will not complete your task. Even if you complete, it will be very, very under the less quality work. So you want every team member to contribute. What will happen if someone is argumentative or arguing all the time? You lose focus. You get frustrated. Okay, Kalas, let us do whatever he or she says. They are never going to agree. So there are some behaviors which are not good. Now, see this scenario. You are going to tell me, is there anything wrong with the team? If there is something wrong, don't shout, just raise your hand. I will ask you, then you can tell me in what way it is wrong. I will read it for you. In a small group learning session, a group of nursing students was tasked with discussion of managing a clinical case. However, some students arrived late, while others were disengaged, unprepared, failing to research their assigned topics. So the discussion were minimal and several students were disengaged and did not contribute. As a result, the group struggled to progress, missed key learning points, and failed to develop a clear understanding of the case, negatively affecting their overall performance. Read the case one more time. Try to visualize if this is your team, how will you feel, and what is happening in the scenario, and what are the reasons why this team is a failure. Just think about it. Whatever reason come to your mind, raise your hand. I will ask you. You can first spend 2 minutes on reading the case. Do you think it will not happen to us? No, it may happen to us. Sometimes we are not lucky enough to be part of a performing team. It has happened to all of us, to me many times, but we have to accept. But what is the reason why this team is not performing well? Anybody from here?
Some students are arriving late.
Okay. She says some students arrived late. So what?
They're not gonna
So,
finish their tasks on time.
okay. Anything else? Is it okay to be,
They will miss the deadline.
you will miss the deadline, okay? In a healthcare profession, the first thing you have to learn is punctuality, okay? You have to be there on time. If the surgery is 8 o'clock, you should be there at least 7:50, not 8:10 or 8:05 or 8:1. If the lecture starts at 10 o'clock, try to be here. If you really want to attend, try to be here at 9:55, not coming at 10:05, 10:10, opening the door, giving your attendance and searching for a good seat. Where should I sit? Greeting your students, greeting your friends, and then going and sitting in your seat. It's okay. So what? One student arrived late. What will happen? When the discussion is going on, whoever is being part of the serious discussion will know that someone opening the door is actually disturbing. Someone moving around is actually disturbing. Someone, standing and giggling and talking to other person is disturbing. So arriving late is not a good trait. Okay? So you identified two things, arriving late and any other thing?
Unprepared.
Okay, unprepared, yes. Okay, two things we identified. Anybody? Yes. Yes, this is the outcome. Yes, they didn't understand the case. This outcome is because of some of the things happening here. Some of them came late, some of them didn't study. Then any other behavior which is not reflect a good team member? In this line, several students were disengaged and did not contribute, meaning the discussion was there, but they didn't give their input, they didn't want to be part of the discussion. Naturally, the team miserably failed. Can this be avoided? Can this be prevented? Are there any, how this could have been prevented if you are the team member or if you are the tutor, or do you have any ideas how this can be prevented? Yes. Yes, absolutely. You start with the rules. Okay. You can have some ground rules. Do you think rules are important? We all are alive inside this room because of some rules placed by the government and the society. Do you think we all will stop at the red signal if there is no rule like that? No, definitely not. There are certain rules in place to ensure our safety. Similarly, if you want a team to perform well, we need to have some rules. Okay, what are the rules? Yeah. Okay. Respect others, trust each other. Yes. Arrive on time. Any other rule you want to tell? Come prepared. Yes. Be more organized. Good. Be respectful. Good. Try to contribute. Yes. So you are part of the group for some reason. So tell something. Open your mouth and contribute. Yes. Yes, this is again very important, which we see lacking in some of the teams.
Don't shut down others' ideas.
Absolutely. When you are part of the team, some of the team members may not be of your choice. Okay? Different culture, different color, different personality, different country, different gender, but still we are a team. We try to respect each other, no bias, no judgment, okay, because here our aim is to save the patient, okay, so there should not be no bias whatsoever, okay. So these are the ground rules, especially in educational setting. These are the main ground rules: starting and finishing on time, coming prepared, listening to others without interruption, saying when you don't understand, very important. When you are attending the lecture, stop me when you don't understand, okay. There is no doubt, which is very silly. Just raise your hand and tell me, this is the place where I have a problem. Can you explain again? In a team, if a doctor says, or if someone says, give this medicine 10 milligram intravenously, you didn't understand what does intravenous mean, stop, ask, can you explain? There should not be any miscommunication. The communication should be very clear. Addressing the whole group, switching off mobile phones, or at least putting them in silent mode, or you should not get distracted when you are focusing or discussing a particular case, or if you are working as a team. Treating others' contribution with respect, very important. Keeping personal issues out of the task. Yes, you don't like someone because he or she didn't treat you well, you called someone and they lied to you, it's okay, it's all personal. Now, inside the college, inside the theater, inside the emergency room, we are not we are part of the team. We are not individuals, we are part of the healthcare team. And please maintain confidentiality within the group, no gossiping, okay. Just because something happened in the group, someone got scolding or someone did miserably bad, don't start spreading or start gossiping. The team maintains its own confidentiality. With this ground rules, maybe the scenario could be like this. The same scenario, but the last for these 4 lines are different. In what way? Yes. For example, we will give you a scenario and ask, what is wrong with this group? Or identify certain behavior in this group, A, B, C, D, E. All of you will get only MCQs. So we will list some behavior and say, this group exhibits all the following behavior except, or identify the behavior from this group, from this scenario, will give 5 options, okay. So what do you think is happening in a right way in this group? In what way this scenario is different from the previous scenario? Do you remember the previous scenario? Same scenario, but a different process, yes. They all arrived on time, okay. They are well prepared, okay. They actively participated in the discussion. They shared their insight, yes. They supported one another. Yes, absolutely, they contributed, and the outcome successful. The team worked successfully and learnt whatever is expected out of them. They had a very good understanding of a particular case, whatever it was assigned to them. So what makes a successful team? You should be common purpose. We should have measurable goals. In a team, sometimes there is a leader, okay, team leader, and the team leader may keep change across different weeks. We can choose different members as a leader. We should have mutual respect, clear communication, and whenever there is a conflict or disagreement, we have to work on resolution or coming to a compromise, and we have to stop the conflict. So conclusion, effective teamwork leads to better patient outcomes. All teams undergo different stages of group dynamics. What are the 4 stages? Forming, storming, norming, and performing, okay. Clear communication is the key to success. Follow the ground rules. Trust and respect all team members. Regular feedback and reflection is essential for growth. And now Any questions? If you don't have questions, I have few questions after this which I want you to answer. So before that, if you have any questions, ask me. In teamwork, not in assignment. Assignment, I'll come back. Are we clear? You know the definition, you know everything. You focused on the discussion, so you are now ready. It's okay, you can make mistake, it doesn't matter. We will see. But now I request all of you to keep your phones down. Don't see your PowerPoint or don't see the PDF, whatever you have. Try to think from your brain, try to reflect, and we will see how much we are able to answer. No group answer, no shouting or whispering. Just raise your hand. I will just tell who should answer. Okay. Are we ready? Okay. Wait, no need to tell. I will give you 5 options. Okay. The definition of a team. Just observe. Whoever raises your hand, I will ask that person to tell why other options are wrong. So just because you saw the right option, don't raise your hand. Look at all the options and think why other options are wrong. There is only one right option. In the previous group, someone asked me, all options are same. No. They look similar, but they are not same. Anybody with the... Okay, take your time. Another 1 minute. Yeah. Are we ready? Can I ask? Anybody from there? Anybody got the correct answer from that side group? Last 4 rows? Anybody? Nobody from that side? The last rows. Try. No? Okay, these last 4 rows. Okay. No. I'm not come. No. Yes, try. No, behind you. Try. It's okay. No? Yes. Okay, we have an answer now. One of your friends said A. All of you agree? It's A? Okay. A is correct, but why? Wait. Yeah, coming. Wait. Okay. Why option B is wrong? B. Comment only on B. Why option B is wrong? Yes. The first word says large group. No. Okay. Option C. Why option C is wrong? Individual goals. It is not common goals. Correct. Option D.
There are 2 mistakes.
Yes, it's not only large group, it's also individual goals. Don't shout. Option E, why it's wrong? Option E is not a team. Why? Yes, the word lack. Lack means no, without. This group doesn't have a commitment or skills. So what I'm trying to say is, in your exam, read all the options. Exclude all the options and then be confident and then put the answer. You will have a lot of time. Okay? So don't be in a hurry to answer the questions and get out of the hall. No. You answer, you go back, read it again and ensure other options are wrong. Yes. Next question. One of the following is one of the following is not part of the process. I expect answer from other students who have not answered till now. Just try. It's one of the simplest questions. Don't bend down. I can see you. Even if you bend down, I know. Okay. So what is the answer? Yes, anybody? C, correct. Of course, in your exam, you will not have such easy distractor. I didn't have time, so I put writing. So there will be a word which will make you, confuse with other words. Okay. Okay. Now, fill in the blanks. In exam, there is no fill in the blanks. It's all MCQ. But now we don't have time for all MCQ, so we are just revising the important points. Okay, you see the PDF, it's okay. At least see the PDF and answer. What is the, yes, very good. 8 to 12. According to research, ideal small group is 8 to 12. 8 to 12. Okay. It is a dash-centered learning. Is it a tutor-centered, teacher-centered, adult-centered, learner-centered? Anybody? Learner-centered. Learner-centered means students take the more task. They decide, they discuss. So for any team, it is not the teacher or tutor, it is the learner-centered setting. Okay. Now, look at the description. Look at the description and tell me which.
Not forming.
Keep quiet. Anybody? No, it's good. Anybody at the back? Anybody you want to take? Which stage is this group? Look at the description. They are not happy, frustrated, conflict, disagreement. So which stage is this? Anybody from the black, please? Just try, even if you are wrong, it's okay. Yes? Yeah. Storming. This group is storming. Yeah. Yes? Okay. This group is. Okay. See, we are telling, no, this stage they are having, what is this, conflict, disagreement. So this is the stage of storming. Okay, next stage. They start accepting, they start to focus, they start to, towards perform. It is not yet performed. They are working towards performing. So, what is the stage? Thank you very much. Yes, I am happy. It is norming, the third stage. Okay, so they have their own roles, responsibilities, and they have started to work. Now, this stage, look at the description, excitement and anxiety. Now only they are creating the structure. They are working on their goals. They are working on the role. So this is one of the first stage. What is the first stage? Forming. Thank you. Forming. F for first, remember. Forming is the first stage. So they are excited and they are working towards, they are writing the structure, goals and roles. Yes. And this stage, I think, the last stage, accomplishment. The key word here is accomplishment, and they are progressing. So it is performing. Okay. Thank you very much for your attention. And those who have questions on assignment, please ask me now. Before you ask, please wait for a minute. I will tell you the rules one more time, the guidelines. It should have an introduction, the main component and the conclusion. The subheading, you should write introduction and write the introduction. Then main content, have subheading and then conclusion. There has to be a title page and also table of content.
Do we need table of content? Because the
It's okay if you already submitted. Yeah. Okay. If you have already submitted without table of content, forget it. But it's always a good practice to have table of content. All these things are there in the presentation I took. Okay, the first page, the second page, what is in-text citation, what is reference, everything is there in the PDF which I took. You can go back and refer. Some of you have already submitted, and I see there is only reference. There is no in-text citation. We recommend all of you to put in-text citation as well. Now you ask me, yes.
Doctor, can you make the assignment give us more time, like after the midterm?
No. This is part of your midterm, so this carries 10 marks, okay? So please submit before midterm. Okay, he asked a question, both are only one. What is your answer?
what?
Yeah, exactly, what both?
Only the writing.
So maybe he didn't go to the course. We removed second assignment. There is only one assignment. Okay? Only one. Okay? Yeah. Yes, if you have already first of all, don't submit now. Keep it with you. Think about it, try to improvise it. Maybe you can submit it on 3rd, 4th, 5th or 6th of November. One second, keep it with you. If you have already submitted and if you want to take it back, let me know. At the end of the class, I will take down your name and ID number. I will go to the setting. I will return it back to you. Okay? I will not return to everyone unless you ask me.
Can we go beyond 500 watts?
Yes, up to 600, okay, but not 800, 900, no. When we give 500, please respect that 500. Maybe plus or minus 10, 20, it's okay. You put 1000? Okay. Anybody? Any other queries?
Extra 100?
Yeah, okay. Any more doubt? Don't come to my office behind me. Whatever questions you have, please ask me because I have a meeting. You will not find me in my office. Ask me now. Oh, sorry. Good morning. Yeah.